The city on March 27th launched the drive-through testing sites at the state fairgrounds. We have been seeing 700 people a day, every day since then. We run Monday through Saturday, 9 to 6:30. And our focus is to make sure that we're getting people through so they have access to testing. We've identified primary care providers across the city, and we now have a listing on the city's website where you can go and find a primary care provider who's accepting patients uninsured and insured, so that you can get a prescription in case you need a test for COVID-19. Transportation. We've been working on identifying providers who can take people into the fairgrounds to be tested, regardless of how much money they have. We're making sure that cost is not going to be a barrier. And you can find all of this information on the city's website at detroitmi.gov. We have very, very clear links to that information.
But I want everyone to know that mental health services are here in Detroit, Wayne County. Service providers such as the Children's Center are doing telehealth services to existing clients, and we're working to get new clients virtually in the door every day.
When families are in the home for longer periods of time, because we see it over the summertime and holiday seasons as well, that there's an increase in stress and tension, and the dynamics sort of shift. So we want people to be mindful and look out for signs of stress, because that could increase instances of abuse amongst the adults in the home as well as the children. So it's going to be very, very important for you to utilize your sources of support right now.
We want you to know that Detroit at Work and the city have partnered with more than 35 employers so far across the metro area. And there are more than 1,100 jobs that we're trying to fill. So companies like Henry Ford Health Systems on the Boulevard, they need CNAs and environmental services techs and patient transport folks, not to mention LPNs and RNs. There are delivery driver positions, grocers and drugstores like Meijer and CVS and small markets. Go to DetroitAtWork.com and we can help match you with the opportunity that's right for you.
As many students that we could train that were already in a number of our programs, we tried to shift to online, and we're continuing to look for ways in which we can increase that training in different areas. So what we are really looking at right now is how we maintain and make sure that as jobs come back, as employment comes back, people are ready for those jobs. We know that people are going to have a lot of issues surrounding unemployment and being laid off right now. We want to ensure that as soon as our economy starts to pick up again, we are making sure that people can get involved in that again and get employment again. But I really want to make sure that people know that Focus Hope is still there to provide food for seniors who need it. And all you have to do is call us. I want to give you a number for that. It's 313-494-4600. We make the application process very, very simple. There's not a lot of information you have to give to us. You can pick it up from us and we'll put a box of food in your car, or we'll come out to your home and deliver it to you if you're at home.
We've been keeping in touch with our families, and we've been devising a virtual learning platform for our families that will be both online and in a print form. We know that there is a huge digital divide and that everyone does not have access to technology. We are currently working with businesses and community members so that we can find a way to ensure that each family has internet access and a tablet or a laptop. As you know, spring break was slated for April 6th through the 13th. So we will continue to serve food during the time that was slated for spring break. At this point, we will continue to most likely work through spring break to ensure that our virtual online plan is in place to launch on April the 14th. And from there, we will have some instructional videos and messages, robocalls, and texts leading up to that point to explain to parents and families and students on how they can access the resources, much like we've done in the past. And there will be teacher engagement. We will make sure we're taking care of the social and emotional support for our families because that's critical. And we will provide support for our students who have IEPs as well as our students who are English language learners.
Some of the things that we're getting a lot of calls in my office about is the direct payments. And these are the $1,200 that a lot of folks are talking about. So know that the first round of checks will be in the first week of April 13th. Again, that's only just the first round. You talk about millions of people. I already saw a figure of showing about 6 million folks, though, that have already applied for unemployment benefits across the country. If you make less than $75,000, you qualify for the $1,200 with an additional $500 payment per minor child. But if you do get SSA and you're a senior, you will automatically get the payment, so you do not have to fill out the form. However, if you are someone that's low income or don't qualify to fill out a federal income tax form, which is a lot of residents in my district, we do now, IRS is requiring, we're still fighting them on it, requiring in their guidelines that they fill out a payment or some sort of form, which I believe is going to be a zeroing out like federal tax form to be able to get it. Because there are so many of our residents that are unbanked and don't have direct deposit, that means longer wait period. I signed a letter with Congressman Kildee saying that should be the opposite. Those that are probably unbanked are the most vulnerable, lower income should get their checks first. And so we've been pushing back on that because now IRS is saying it could take up to 10 weeks or more for those that don't have direct deposit options.
If you are being told to stay home for 14 days, the good thing is if it's related to the virus, there's up to 14 days paid sick time. One of the things that Rashida and I didn't like and we're trying to get fixed is there was a cap on the number of employees in a business that would apply to. And so I don't know why the folks wanted to put 500 employees when if you're working at Walmart or if you're working at Amazon or any other big employer, you have the same problem if you're not getting a paycheck because of having to stay home for 14 days. So that's an area that is a weakness in the law, but we never had any paid sick time before.
I want folks to know, seeing those numbers of 6 million across the country, you may not have qualified for food assistance before. We're asking you to reevaluate and look, and I'll give you the information to how to do that, but you may qualify for food assistance now. And so we want folks to know that if your income has been decreased significantly because of this national pandemic, if you've lost hours, if you lost your job, things have changed significantly for you in your life, know that you may now qualify for SNAP assistance or what we call food assistance. So we really want to encourage people to apply.
But we also added this very expansive new benefit structure for unemployment benefits. Now it's not up and running yet. I just checked in today again with the Michigan Unemployment Office. They're a few days away of being able to implement the changes that will expand who can receive help. They're also scrambling right now. We gave them resources to hire more people. They've got, they're hiring more people to answer the phones and to process the benefits. They said 90% of their staff right now is focused on processing benefits. But in a few days, and I would say just kind of, we need to pause for a moment and let them be able to get this together. But in a few days, we're going to see an expansion that covers more part-time workers, people who are self-employed, somebody who's maybe furloughed but not actually laid off. Maybe you're furloughed to keep your health care and couldn't get help. And so there's a whole group of people. And so we need to be really looking at that specifically.
Please know a fourth package is coming, and many of you are service-based organizations, but you're also advocacy organizations. Please speak very loudly about it having to be much more inclusive. A lot of the undocumented community, many of them who have tax ID numbers that pay taxes, are excluded. That impacts the children that we serve in our communities, especially in Southwest Detroit and other communities where on the east side, where we have a huge number of immigrant communities that are getting left out. And we want to again be looking through this lens as experts, as public health experts, and saying that we have to be as inclusive as possible and as aggressive as possible.
There is, I think, something that we've not done before, which is we do loans, that's for sure, but we've structured it so that if you're a small business and you need a loan, There's also some grants available, but if you need a loan and you can keep your employees on the payroll for the next 8 weeks, the cost of doing that and the cost of the overhead for your small business will be written off the loan. In other words, it's a grant. So the whole focus we've had for medium and larger businesses too, is you get help if people continue to get a paycheck. And I think that's an incredibly important piece of how we're trying to do this.
This is really uncharted territory for our country. So I think, again, to encourage folks, even those that are questioning whether or not they qualify for unemployment, to please just apply for food assistance, all these things. And again, a lot of these requirements have been waived. A lot of expansions have happened with these programs, and it's important to at least try.
We are concerned about our most vulnerable population, but this will go until the end of the year. And so while it is going to take a little time for everybody to be reached, it doesn't expire until December 31st.
Thank you to all of our panelists. These town halls will be every Thursday from 12 to 2 to bring you the most up-to-date information. It is important that we try to find strength in each other. As a community, we are here for you and each other. Thank you so much again for joining us today.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.